It is now my pleasure to introduce our student speakers, one from each program. We'll begin with PhD in Social Policy, Brooke Evans.
Good morning. I think I might be shedding, so if you find orchids around the building, I take full responsibility. Welcome, everyone. I am grateful for the opportunity to speak to you this morning as a representative of the PhD class of 2019. Before I came to the Heller School, I was working with healthcare for the homeless on the island of Oahu in my home state of Hawaii. As a clinical social worker, I worked with a team of medical professionals to meet the medical, mental health, addiction, emotional, and housing needs of patients. This could mean helping someone living on the streets obtain much-needed medications, or talking with a person in recovery about how their sobriety might be challenged by housing insecurity. We worked tirelessly to assist patients with obtaining health insurance and to navigate a confusing and often disconnected healthcare system, tasks that are challenging for most of us, and even more so for someone living with homelessness. Experiences like these brought me face to face with healthcare inequities, service gaps, and numerous other problems embedded in our current healthcare system. They ignited a desire within me to improve and reform healthcare systems and services in the United States. To do this, I knew that I would need to leave Hawaii to broaden my knowledge base and learn effective tools to connect the dots between clinical care, research and evidence, and policy. 5 years ago, I took the 5,000-mile journey to the Heller School to embark on the adventure of getting a PhD in social policy. It was an adventure, right? After I got over the culture shock of New England, have you seen how people drive here? It's very different in Hawaii. And after I learned how many layers I would need to get through a Massachusetts winter, I settled into classes and the goal of learning research. Having been out of school for 10 years, there was definitely a learning curve. But slowly and surely, I found my footing as a researcher and policy practitioner. Through my educational, research, and work experiences here at the Heller School, I have been able to take learning to the next level and to integrate my personal passions with education, research, and policy. I have learned and worked with some of the brightest minds in health policy, many who are on the stage right here, and taken part in conversations and activities on how we can improve the US healthcare system to better meet the needs of all people, not just those with privilege, wealth, or resources. Today at Commencement, I'm excited and eager for what is to come. I'm also aware of the responsibility that comes with this important achievement. The responsibility to be part of creating and affecting social change. President Barack Obama once said, "Change will not come if we wait for some other person, or if we wait for some other time. We are the ones we've been waiting for. We are the change that we seek." For the 12 of us graduating with our PhDs today, we will leave the Heller School to be part of changing and reforming social policy. We will go into academia, some already have, the private sector, and government. We will uncover societal problems and social inequities, and we will use data and evidence to support social change and transformation. We will use our unique skill sets and our PhDs to be the change that we seek in the world. Congratulations, graduates. We did it. We wrote our dissertations, we got our PhDs. Now let's get out there and work on start making change. Thank you.